One, I'm honored to be joining you as your mayor for another 4 years. Thank you for giving me an opportunity to continue serving our residents. Let's talk about something together. We saw a jump of over 100 cases in Morgan County from Friday to this morning, and that's not the kind of news that we want to share with you on a weekly basis. Now is the time for us to buckle down and finish 2020 strong. We encourage you to continue following the guidelines as introduced by the Department of Public Health. Today, our guest, we have with us Morgan County Commission Chairman Long. Ray, thank you for joining us.
Oh, glad to be here, Mayor.
Yes, sir. And then we have Kelly Powers, President of Decatur Morgan Hospital. It's good to have you with us again,
Thank you.
Kelly.
Good to be here. Thank you.
So let's give you a few municipal updates. Current Morgan County COVID-19 cases, 3,558. That brings us to a 6.24% weekly case increase. Morgan County has now been listed as a very high-risk county on the risk indicator dashboard, making us one of 6 counties in the state with this classification. We just can't emphasize how important it is for us to remain vigilant. Remember to continue wearing your mask, sanitizing, and practicing social distancing. Remember that City Hall is open. It's easier to call before you come or visit our website and email the department. Oftentimes, much of your business can be handled over the phone or by email. We'll talk a little bit about Halloween safety as you begin to think about the upcoming holiday season. Please remember that we still need to wear our protective masks, not just a costume mask, and socially distance. Be responsible so we can avoid community spread. I believe we put some information regarding the Halloween on our website that you can find there that offers some tips that has been suggested by public safety. Also want to encourage you, if you haven't already done so, to complete your census at my2020census.gov or by phone at 844-330-2020. Your input helps us to direct federal funds for our schools, roads, and other public services. Collection operations will continue through October the 31st, 2020, and we're thankful for the extension. Remember to contact someone in your neighborhood, check on them daily. We remind you of that every week, and especially your elderly neighbors. So with that, Chairman, what about an update from the county?
Thank you, Mayor. Speaking on the census while we're there, we are still in 4th place in Morgan County. We're running about 71% right now, where 10 years ago we only was at 67. So we're having a good turnout for Morgan County, but we still need more. 70 is just barely passing. I mean, that's a C. We don't like that in school. We wanted A's. So we need at least that 90%. And we've still got, like I say, several weeks to do it because of the extension. And as the mayor said, it's so important. I mean, we have so many funds that depend on the census that we really need people to do that. As far as everything else in the county's running good. Most people got your property tax notices here last week, and we want you to know you can pay them online with no extra fees. We've waived the fees for all of that. We want to make it as convenient as we can for our citizens to pay their bills and do things that they need to pay at the courthouse without coming in. So the county commission has waived all the fees for your property tax, business license coming up soon. All of that stuff you can do online, and it'll keep you from having to come to the courthouse and take a risk of being around people. These masks are so important. I mean, as the mayor said, the numbers are climbing, and we was in the green for so many weeks that everybody kind of got laxed. I believe I was at Lowe's just a few days ago, and a few weeks ago you couldn't go. Everybody had them on, but you had to struggle to find somebody that had them on because we get so lax with that. It's real important that we continue this until we have a vaccination. It's not going away by itself. We know that, man, and we've all got to be in it together. I mean, we got to do our part. I mean, it's whether we like to admit it or not. If you get on social media, you see people say there's nothing to it and all that. But if there's nothing to it, we wouldn't have over 200,000 people dead today because of it. So it is real serious. We're in a war with an enemy we can't see. And so it's so important. If you don't believe in masks, wear them anyway. Protect your family. Do it for your family and your friends. You know, we've got to continue taking this serious. And if we don't do it, then we're going to continue to see the numbers raise, and we just don't want to see that. We can do better than that.
Thank you, Chairman. Thank you. All right, Ms. Kelly.
Yes, good morning. I wanted to give you an update on where we are at Decatur Morgan. We currently have 22 inpatients, 10 presumptive patients waiting on the test to come back, 7 in ICU, and 6 on the vent. We have seen a spike. We went up to as much as 24 late last week and back down to 22 now. But as you said, and we saw in the data, we are seeing an increase in people with COVID-19 from Morgan County. We have 9 employees who are out right now with COVID and 14 that are self-monitoring. So one of the things that we are doing as a hospital, our ICU has been full. Even though we only have 7 COVID patients in ICU, we are seeing a lot of sick patients because they're delaying getting care. And we really need for the community to go and see your doctor, get your test done early, because you do not want to delay care and get sick to where you can't recover. So I just wanted to make sure everybody goes and gets the lab work, sees their doctor, whether it's on the phone or in person, and get help when you're sick. That is filling up our ICU now. Plus, we are seeing flu. So you can have flu and COVID. So I want to encourage everybody to get your flu shot. Go ahead and get it now. Again, some of those patients are really, really sick when they come in and have both the flu and COVID-19. One of the things that we're also working on is adding a COVID unit at Parkway. So we're looking at starting with 15 beds. We're trying to open it the 1st of November, but we have to hire all new staff. So if anybody is interested in working, let us know. We need nurses and techs, just a variety of different jobs here in Morgan County, which will help us. But we are hoping to go all the way to 36 beds. And when we talk about this, it's not going to go away anytime soon. So what we're hoping to do is make sure that we have capacity so that we do not have to stop elective surgeries again at the main campus or at some other campuses in the system. So this will really help us by adding beds over there. The other thing I just wanted to say was it's also breast cancer awareness, so please get your mammogram as well. I would hate for somebody, because of COVID-19, to not be able to detect cancer early so we can take care of it. So.
Thank you, Kelly.
Thank
now,
you.
I have a question about the Parkway campus and the plans for early November. Will that be a regional facility or?
Yes.
Okay.
What we're going to do, though, it will serve Morgan County first. So we have 2 units right now at the main campus that are COVID patients. So we'll go down to 1, hopefully if we can, and put the patients in Parkway, and then we'll build up to 36 so that we can take patients from, Athens, Helen Keller if needed, or Huntsville Madison hospitals, so that they don't have to stop elective as well.
Okay,
So
and
that's
it's
our
low
goal.
acuity.
It's a low acuity, yes. It's not patients that would need ICU care. If they do, we transfer them back to Decatur. Another project that we're working on that I need your and Commissioner Long's help with is we're going to ask FEMA for some money to build another ICU at Decatur. And it would be a 12-bed, state-of-the-art ICU. We currently have 19 beds and they stay full, so we want to add this other ICU to put COVID patients in. So a lot of good things happening.
Good. Well, we're thankful for Decatur Morgan and
Thank you.
our Parkway campus and the health care that our residents can enjoy.
Yes, thank you.
Thank you for being here. So do we have any questions? Okay. Very good. Well, our next press conference will be Monday, October the 19th, a little different time. We'll join you at 11 o'clock, and I hope you have a nice week. Thank you.